Cervical cancer affects over 13,000 women in the United States each year, with nearly 4,200 women dying from the condition in 2017. The human papillomavirus, HPV, vaccine, fortunately, makes cervical cancer highly preventable. HPV is a very prevalent virus that is passed from one person to another through sexual contact. Cervical cancer is caused by a variety of factors, including HPV, smoking, multiple sexual partners, contraceptive use, history of sexual transmitted infections, STI, having multiple children, HIV, organ transplant. The death rate from cervical cancer has fallen by more than half in the last 40 years because to the Pap smear test and the Gardasil 9 vaccine. In the early stages of cervical cancer, there are usually no symptoms. Women may begin to notice the following cervical cancer warning signals as the cancer progresses. 7 cervical cancer warning signs. Abnormal vaginal bleeding. The most common cervical cancer warning is abnormal vaginal bleeding. This typically occurs after the cancer has spread to nearby tissue. Although spotting can be harmless, it's important to see your doctor if you experience bleeding between menstrual periods, heavier or longer menstrual periods, bleeding after sex, menopause, or a pelvic exam, or bleeding resulting in anemia causing fatigue. Fatigue. We all experience fatigue sometimes, but when should you start paying closer attention to it? Cancer patients often describe feeling tired, exhausted, lethargic or weak, and having little drive to participate in activities. For those suffering from fatigue, even the simplest tasks can seem draining. The more advanced the cancer, the more likely you are to experience fatigue, loss of appetite or unexplained weight loss. As with many other types of cancer, loss of appetite or unexplained weight loss are warning signs of cervical cancer. This can be especially evident if the weight loss persists regardless of your food consumption. Foul-smelling vaginal discharge. This warning sign is also very common with the onset of cervical cancer. If cervical cancer lacks oxygen, some cells may die off, infecting the tumor. The infection is what creates a foul-smelling vaginal discharge. If the discharge is continuous and appears to be pale, watery, brown, or mixed with blood, you should contact your doctor. Pain during sexual intercourse. Pain during sexual intercourse can occur in women with advanced cervical cancer. The tumor growth throughout the tissues and reproductive organs is what causes this pain and if experienced, should not be ignored. Lower back, pelvic or appendix pain. Lower back or pelvic pain can be linked to issues with the reproductive organs, such as the cervix. Pelvic pain, especially pain that is continuous, is a telltale warning sign of cervical cancer. Pain near the appendix does not usually occur unless the cancer is in an advanced stage. Pelvic pain will generally follow other cervical cancer red flags. Leg pain. As the cancer progresses and reaches more advanced stages, it can start to press against nerves in the pelvic wall, resulting in leg pain and swelling. Swelling accompanied by leg pain could be a warning sign of cervical cancer, however on their own could be symptoms of various medical issues.